Hi, I'm Courtney Skarzinski, and I'm a student of Auburn University's graduate nursing program, and I'm doing a presentation today on Menieres Disease, or MD. So MD is a condition that's characterized by episodic vertigo, tinnitus, and hearing loss, and these are the classic triad of symptoms, and they are most likely caused by endolymphatic hydrops of the labyrinth system of the inner ear. To the right there, you have an image that shows a healthy inner ear compared to an inner ear that's been diagnosed with MD. Now, Menieres syndrome is the symptomatic triad of episodic vertigo, tinnitus, and hearing loss that occurs secondary to other inner ear disorders. MD can occur at any age, but usually it's between the ages of 20 and 40 years that it's diagnosed. And the Menieres syndrome in children is most often associated with congenital malformations of the inner ear, and in adults it may be caused by acquired otologic disease. The incidence of MD ranges from about 10 to 150 per 100,000 persons. And then among patients with MD, bilateral disease occurs in about 10 to 50% of patients. Most patients tend to cycle from an active symptom to prolonged remission. 3 essential questions that you want to be asking your patients. Have you had 2 or more spontaneous episodes of vertigo, each lasting 20 minutes to 12 hours? Have you had reduced or distorted hearing, tinnitus, or fullness in the affected ear? And do you have symptoms that are not better accounted for by another vestibular diagnosis? With your examination, the main thing that you're going to be testing is hearing in your patients. So you're going to do audiometry to tell how much hearing loss is present. The most documented audiometric pattern is in early MD is low to mid frequency hearing loss in the affected ear. And most patients typically have vestibular symptoms for about 3 to 5 years before they meet criteria for diagnosis of MD. On the chart there to the right, or the table, it's the Menieres Disease functional level scale, and you can use that to see how severe patients' symptoms are and how they are affecting their daily lives. You can also do vestibular testing, which is not mandatory, but it does help to determine treatments in patients with more severe or persistent symptoms. You can do imaging, and that includes an MRI or CT. Again, it helps identify features that support a diagnosis of MD, and then it also helps to rule out other differential diagnoses that may be causing the symptoms. And then you can also do blood tests, including a test for antibodies, a test for endolymphatic hydrops, and then vestibular evoked myogenic potential, and that helps the diagnosis and monitoring of the disease as well. Treatment for Menieres disease is mainly to help symptom management. With non-invasive management, up to 90% of patients can maintain normal daily activities. Initial therapy for all patients include dietary and lifestyle changes, and this includes salt restriction, making sure you're limiting your caffeine and your alcohol intake, avoiding nicotine, and then also avoiding MSG as you're able. You can refer patients to vestibular rehab therapy to help maintain balance. And then if lifestyle modifications therapy is not working, then you can move on to medications. And these most often include a vasodilator, which is mainly beta-histamine, and then diuretic therapy if the beta-histine is not working. And then, of course, you can do medications to help with vertigo episodes like clonazepam or Valium, and then Phenergan or Zofran to help with any nausea or vomiting that occurs with the symptoms. And then if patients are having poor quality of life 3 months after starting therapy, you can move on to glucocorticoids. You can do gentamicin, consider other causes of the symptoms, or even surgery. So you can have a labyrinthectomy or vestibular neurectomy. And then education for patients. You want to explain that the goal of treatment is to improve the patient's quality of life. You want to avoid all those triggering foods, drinks, activities. Don't smoke. During an episode of vertigo, you want to make sure you're avoiding activities that can make the symptoms worse. You want to rest during and after activities. And then just be aware that during these episodes, you most likely can lose your balance. So you have to be very careful so you don't get injured. And then there is my reference. Thank you so much.